Giggling. Hi everybody, welcome. My name is Abby Lee. I'm the Director of Marketing and Business Development here at Bay Area Regional Medical Center, and today we are live with Dr. Figueroa, and it looks kind of weird back here. I know. We are actually in the NICU, and I know this isn't like your
It's not my area, but that's okay. It's nice to hang out here.
It is, and it's like the best place in the hospital right now. So we wanted to show it to you guys, and also talk about some common questions that can sometimes be a little embarrassing to ask your OB. Some of these I never asked my OB, so it'll be interesting to hear what your answers are along the way, okay?
All right.
But before we get started on these questions, why don't you tell me a little bit about yourself?
Oh gosh. Well, I'm originally from this general area. I grew up in the Sugar Land area and went to medical school right here at UT in Houston. They call it the McGovern Medical School now, apparently, but back in my day, it was UT Houston.
Okay.
And then I did my residency training up in New York at the Methodist Hospital. And now I've been practicing here for 2 years. Joined Women's OBGYN Center with Dr. Dafashi and Dr. Fannin. And it's been really amazing being down in this area.
Awesome. So. Well, for those of you who don't know, Dr. Figueroa delivered the first baby boy here at the hospital, and that is so exciting.
I did.
So why don't you talk about your experience delivering the first baby?
Oh gosh.
Boy.
The first baby boy, yes, not first baby girl.
Yeah.
It was really great. It's funny actually, I feel bad taking credit for it because that was actually Dr. Dafashi's patient. She needed a repeat C-section, and so she was scheduled for that day, and unfortunately he got in a really bad car accident right before.
Oh no.
I know. He's okay now.
Okay, good.
Broke a couple of ribs and things, but so I was there just kind of subbing for Dr. Dafashi, but the patient was very, sweet and gracious about it, and it was really cool though because I was nervous coming in first day of a new hospital's labor and delivery, like, is anyone going to know what they're doing or where to go or what's happening? And everyone just had it together already, which was amazing to me. I know that the nurse directors here just, really drilled everyone and made sure they knew where everything was and how to just efficiently run things from day one. So I was very impressed.
Awesome. So talk about the experience that your moms have had since they've delivered here.
Oh my gosh, they love it.
Good.
I think we have another video of one of my patients.
Yes, and how walked in, you were like, hey!
It was really embarrassing. I was just going to see her. I had no idea y'all were filming. You should put it. Do we have a sign on the door now?
No.
Someone's just going to randomly walk in here.
Hopefully
Sorry.
Not. Hopefully they'll see
awkwardly like I did. But they've all just been blown away with not just the hospital. I mean, having gone to medical school right here in Houston, I've been at most of the L&Ds in the medical center and around Houston, and this is by far the nicest one. It's like the boutique hotel of labor and deliveries.
Awesome.
It's fancy. But it's not just that it's, giant rooms and fancy, it's beautiful here. Mm-hmm. But it also has really cool, like, high-tech equipment, and the people are what make a place, always. Mm-hmm. And the nursing staff here, amazing. They all are very experienced and very, very cool. I love them. But I think it's really neat. There's like all kinds of little things here that you don't really even realize. Like when I did that first C-section and I walk into the ORs, which are gigantic and amazing, you have these extra TV screens above you, and you're like, what are we watching? Like, are we watching TV while we're doing the C-section? Yeah. And it's because they have the ability to live stream with dad if dad can't be there. So
that is so cool.
Yeah, so for like dads that are in the military or an astronaut on the space station, you can watch your baby being born in real time, which I think is just, amazing. I mean, where else can you do that? That's amazing.
That is, wow. That's good to know.
Yeah.
Because you never know what's going on.
Yeah, I mean, anyone, astronauts' wives, come on down.
There you go. Okay, so if you're just tuning in, we are live with Dr. Figueroa here in the NICU at Bay Area Regional Medical Center. Let's just dive right into some common, sometimes embarrassing questions that sometimes people are afraid to ask. and I Googled a lot of these, so you know,
so do my patients.
But it's good. So if you are,
you gotta be careful with the Dr. Google.
So if you're interested, y'all just keep paying attention and ask some questions. If you do have some other questions that we don't ask along the way, feel free to comment those below too. Okay, so is it normal to have bad gas and indigestion?
Yes.
Yes?
That's actually, it's a physiological change of pregnancy. That's a normal medical thing. So when you're pregnant, you have these extra hormones raging, and progesterone especially will slow down your intestines. It slows down your motility. So you end up with a lot more gas, some bloating, constipation. These are normal. I have patients ask me about this all the time. And in fact, a lot of times I'll have patients come in, especially my little skinny patients, and it looks like they're showing, but really their uterus is only up to their pubic bone because they're only 12 or 14 weeks, but it looks like they're showing, and it's a gas, baby. It's normal. It's no big deal.
Does it go away, or does it stay there?
I mean, it stays, it slows down through the whole pregnancy. So,
Okay.
I mean, you're going to have, you know, those sort of embarrassing things happen. No big deal. There's all kinds of ways to treat them, and I let you know what those are.
Okay.
It can also affect, you know, other than affecting your intestines, the hormones can also kind of relax the sphincter at the bottom of your esophagus. And so you'll get a lot of reflux and heartburn. And I'm just like, get your Tums. Please.
Tums, lots of Tums. I ate like Tums by the gallon. I felt like when I was pregnant, I was like, oh, I am like all about Tums.
Oh, yeah.
So is it normal to have discharge during pregnancy?
Yes, that's another completely normal medical thing. You know, all the hormones, again, hormones do weird things to your body, and that's okay. Your body changes in pregnancy, and one of the changes is that you do produce a little bit more cervical mucus, and like a light amount of discharge is just totally normal. You know, there are times when it's abnormal. You know, if you feel any other symptoms that go along with it, definitely talk to your OB about it, but for the most part, normal.
Okay. All right. So I've heard I won't be able to control my bladder after pregnancy. Is that true?
No, not necessarily. It does happen sometimes, and it can happen during pregnancy too. You've got a big old baby sitting on your bladder, but the main reason that happens is because of something called stress incontinence, which is where, you know, you cough, you sneeze, you jump up and down, and little bits of leaking come down. That's usually due to the kind of loosening of the pelvic floor muscles, or, you know, the beginnings of what could be prolapse later on in life. So it's easily fixed, though, if you just keep up with your Kegels. Please do your Kegels. Kegels are so important. Most important exercise you can do in my book, anyways.
Okay.
I see enough. I mean, I see a lot of pelvic prolapse in the office and urinary incontinence. It's a big part of what we do at our practice, is doing what's called urogynecology. And a lot of it starts with, you know, I'm getting the patient's history, and, you know, they're 65, 70 years old, and they're, you know, leaking on themselves, or they feel a bulge down there. And I always start out asking them about their youth and their OB history. And I'll tell you, when you've had 10 babies, or even 5 10-pound babies versus having 1 or 2, you know, that relaxes your pelvic floor a little bit. Even if you've had C-sections, you know, the weight of the pregnancy and the stress of the pregnancy pressing down on that pelvic floor can actually still cause you to have some prolapse or leaking. So Kegels, if you don't know how to do them, come to me, I'll show you. I've got a great pelvic floor physical therapist that teaches them to you if you need.
Ooh, awesome. Cool.
I didn't even know that was a type of physical therapy until I became an OB. It's pretty neat.
Oh, that's so cool. Okay, so have I gained too much weight?
Oh gosh, yeah, I get that one a lot. Especially here in Houston, where the food is amazing. So that really depends on where you start. So if you start out before the pregnancy, you know, depending on what your weight was before. So we do this classified by what's called BMI, or body mass index, which is a calculation of your height divided by your weight. You can like Google BMI and put in your info, and it'll tell you what your BMI is. And so there's 4 major categories, which are, you know, underweight, which is a BMI less than 18.5. There's normal, quote-unquote, normal weight, which is under 25. Between 25 and 30 is considered overweight, and anything over 30 is called obese. Medically, those are the terms. And so it really depends on where you start. So if coming into pregnancy you're underweight or normal weight, you don't need to, you can gain quite a bit more. You've got more wiggle room to gain weight during the pregnancy versus if you come in being, obese or overweight. The general rule of thumb, so that I don't have to like rattle off numbers that no one will ever remember, just you can look them up pretty easily. Okay. But the general rule of thumb is about a pound per week in your second and third trimesters if you're underweight or normal weight, and about a half a pound a week in your second and third trimesters if you're overweight or obese. That's like the general rule of thumb.
Seems like a lot. What does that generally equate to?
So it comes to like, for someone who is obese, you don't want to gain more than 20 pounds is the max. And then for someone who is overweight, it goes to 25, normal weight 35, and underweight 40. Those are all the maximum amounts that you should gain. Okay. And it's important too to not go all the way to that maximum or beyond, because it puts you at increased risk for having a large baby, risking a C-section, gestational diabetes, all these different things that increase. And also, losing the weight after baby. If you put on extra weight during pregnancy, it's that much harder to take it off. We're not all supermodels. We're not Giselle. We can't walk down a runway in a bikini 6 weeks after delivering a baby.
Yeah, no one does. No one.
Other than Giselle. She's
exactly.
fabulous.
Okay, so will I get stretched down there?
Well, yes, to some extent. That's normal. Baby's got to go through small space, and kind of like what I was talking about before. Yes, childbirth can lead to a little bit of prolapse, but if you're keeping up with your Kegels.
Second answer for 2 questions. Okay, that's good to know.
Important. I see too much prolapse in my office. I feel like, come on, people, let's do our Kegels.
Awesome. And is it 3 times a day? Is that what you were saying?
3 times a day. Do sets of 10. I like to tell my patients, do it when you're in your car. No one knows you're doing it. It's not like you've got to wait doing this,
Yeah.
It's clench, unclench, and I say do it when you're in your car, and every time you get to a stoplight, just do 5 or 10 of them.
Oh, that's a good way to remember it. Yeah. Okay. So, all right, this is another one. Will I have a bowel movement during delivery?
That one's a tough one to answer because I don't want to scare anyone, but yeah. It's
normal?
It's a normal thing. It happens. It's no big deal. Poop happens. A lot of people back in the day used to do, enemas before.
I heard of that. I was like, oh my gosh, no.
Why would you put yourself through that? It's a natural thing, It's not a big deal. Most of my patients have done it, and I'll tell you what, they probably high out there in cyberspace. They probably have no idea, because we're all very, discreet and mature medical professionals who are there, and you just kind of wipe it away, and that's that. No biggie.
Yeah, we've
Don't
got
put
a lot
yourself
of
through an
comments
enema.
down here too. A lot of people saying that they love you, trying to.
Aww.
Candy, that's my dog. Awesome, you guys. Good to hear from you. Okay, so if you're just tuning in, we are live with Dr. Figueroa here at Bay Area Regional Medical Center in one of our fancy private NICU suites. Just to show you guys how amazing this is. And this room actually joins to the next one through doors in the room. So if you have twins, you can have your twins close by each other, which is pretty cool.
Which is really neat.
So after this, we'll do another live with a tour with a NICU nurse, so you guys can get the full on, because we're talking about OB questions right now. So if y'all have any other questions, y'all comment those below, and we will try to answer those along the way. Mm-hmm. All right, so we're past the embarrassing questions.
Okay.
Hopefully.
I was blushing too much.
I know. I didn't even want to ask those.
No, come on. That's normal stuff.
It's good to know.
It is. That's normal stuff. Don't be embarrassed to ask your OB those questions. We get those questions all the time.
Good. Okay. So when will I know I'm going into labor?
Oh, wow. Okay. So if you're going into active labor, you're having contractions at that point. So there's a lot of warning signs leading up to it. We can talk about, your mucus plug or things like that, baby descending a little bit into your pelvis. But really it's about the contractions or breaking your water. So if you break your water, and you can break your water before you ever actually go into active labor, typically I tell my patients, if you break your water, you can do one of two things depending on what your GBS or Group B strep culture is. That's a little culture we do at the end of pregnancy. If it's positive, just go ahead and go up to labor and delivery so that they can get you started on antibiotics and be safe. If, however, you're negative, you can wait. You can hang out at home, walk around, get on your birthing ball, bounce, and try to get yourself into active labor on your own, so that you don't have to just immediately come up there 1 centimeter and just get Pitocin going. You can get into labor on your own after you break your water.
Is there like a time frame between having your water break and getting to the hospital?
Different people say different things. For my patients, I usually don't want them, to wait more than 6 to 8 hours. If it's not happening by then, I like to just come on in, let's see what's happening, let's see what we can do. But then, it also depends on the contractions, if the contractions start or not. And contraction timing really depends a lot on if you've had a baby before or not.
Okay.
So, if they're happening regularly, painfully, and they're coming every, less than 10 minutes, 10 minutes, 9 minutes, 8 minutes. If it's your first baby, things are a little slower with the first baby. Usually labor can last a long time. So, so long as you're comfortable enough and you're not wanting to get, an epidural immediately. Me. I'm like 2 centimeters